Depression, my favorite quote. The FDA this week approved the first ever transdermal patch for the treatment of depression. Simply remove the backing and press the patch firmly over your mother's mouth. Alrighty then, so. Actually, it doesn't hold true for my mother. She's fabulous, but it's just a very funny quote. Alrighty, so what are we going to take? Everybody's depressed these days because we're all stressed. All that high cortisol drops our serotonin and norepinephrine in our brain. So we're all like, oh God, I'm so stressed, I'm so depressed. All right, well, let's help you out. 1, reduce stress. 2, say yes to drugs. So the drugs were the number 1 prescribed group of drugs today for depression, you know, are the serotonin reuptake inhibitors. There's no doubt about it. They're the safest. They're excellent. Does everybody get relief? No. This is not a number to treat 1-to-1. So we do know that there maybe 50% of the people get really good relief. 70% may get 50% relief. So yes, we do see relief, but some people don't get anything from these drugs, so we have to switch them. Try something different. And interestingly, if you start them on Lexapro and it doesn't work, then switch them to Zoloft. You may see a great response in the same category. Now, the 2 safest and the most effective in this group, you all, are Zoloft and Lexapro. Those tend to be our first choices. I'm going to just talk a little bit about each one of these, and we see this a little later on, but I'd just like to mention Prozac for a second. Prozac is a great drug for children that are depressed. Now, I'm not pushing drugs for all children who are depressed. One of the best antidepressants in children is a PET. Very interesting. PET or Prozac? PET or Prozac? We see a lot of kids, huh? Prozac. Right. Who takes care of the darn pet? Mother. But anyway, again, interestingly, the reason the FDA has only approved Prozac for children, and this is important because some people say, well, I'll just give them Zoloft. Prozac has a long half-life, which means if the kid misses a dose, their mood does not plummet. Zoloft's half-life is less than 24 hours. Prozac's half-life is up to 9 days. In fact, in Prozac, you can take, in elderly patients, you can take it once a week, every Saturday. But not Zoloft. You got to take it every day. So if you got a kid that's not going to be compliant with their drugs, then the Zoloft is not going to work. So there is a reason for the FDA to approve just the one for kids. Paroxetine's a very strong drug. Has the most drug interactions. Paxil. Citalopram, great drug. The son of citalopram is escitalopram, which is Lexapro. So Celexa, Lexapro, great drugs. All right, then you say, well, I don't know, maybe we should try something else. Let's go with the SNRIs, so the serotonin norepinephrine reuptake inhibitors. Venlafaxine, antidepressant, also reduces anxiety. Desvenlafaxine, which is the son of venlafaxine, which is Pristiq. And then duloxetine, which is Cymbalta. Cymbalta is the first drug ever to be approved for 2 indications at one time. That's very, very rare. It was approved for the treatment of peripheral neuropathy. At the same time, it was approved for the treatment of depression. Okay, so there we have it. We've got lots of choices. We've got more choices. The other category, if those don't seem to want to do the work, then I like the drug called bupropion, which is Wellbutrin. This is a great drug, you all, for young women who are depressed, that are just married. Let me tell you why. If you are depressed and just married and I put you on Zoloft, your sex drive will take a nosedive. I'm not saying just married is the only group, but if you don't want to have sex again in your life, then go on one of the SSRIs. 60% of all people on SSRIs, men and women, have absolutely no libido. And they can have sex all day and never have an orgasm. So they're anorgasmic, they are no libido, there is no zip to their doodah whatsoever. Now, why would you do that to somebody who's newly married? Remember when you used to have sex all the time? You just got married, of course, everybody, woohoo! Kitchen sink, chandelier, everywhere. Now, you've been married 30 years, you plan it. right? Saturday morning at 10:05. If I'm not there, you go ahead and start without me. So, things change over a relationship. Nothing wrong with that, but it's just not quite what it was when you were 20, 22, whatever age. But Wellbutrin is not a drug. The reason you lose your sex drive with the SSRIs is because serotonin goes up, you're happy, but dopamine goes down. And in the brain, dopamine is responsible for your zip to your doodah in the bedroom. And if it's gone low, then you're like, oh God, I don't have any interest. I love my husband, but I don't want to have sex with him. Well, that just isn't going to work. Unless you don't love your husband. Okay. Wellbutrin pumps up dopamine. It gives dopamine a boost. So not only are you happy, but it also gives you a little zip to your doodah. So would you ever give the husband Wellbutrin and the wife Prozac? Would you do the opposite? Yeah, then their sex drives might meet in the middle. Okay, mirtazapine, for those of you psych nurses know this one. It's a good drug for as an antidepressive, but it really makes you gain weight. You can gain 20, 30 pounds. So it's a great drug for a very frail person who needs to gain some weight. But you don't give it to somebody who's struggling with weight issues. Okay. The older antidepressants are used primarily today for neuropathic pain. You never prescribe Elavil for depression. We use Elavil almost exclusively for neuropathy. So let me just mention that any drug that boosts serotonin and norepinephrine can be used for neuropathic pain. So the drugs we will choose will start cheap and start with amitriptyline. Low dose. At what time of day? Nighttime. Why bedtime? Huh? It makes you really tired. Yeah. And the good news is you're tired when the neuropathy rears its ugly head the most, at night. So by giving Elavil at nighttime, A, kills two birds with one stone. Boom. You're sleepy because it's a potent antihistamine. And number two, it reduces the pain of neuropathy. So it's really a good drug. It's cheap. And those low doses we use are not highly anticholinergic, so the side effect profile is very low. All right, Pamelor is another one. Nortriptyline. Amitriptyline works the best, for sure. All right, drugs that also block the reuptake of serotonin norepinephrine can be used. Cymbalta is also used for neuropathic pain. No, Barb, they just haven't worked for me. Can I use something else? The answer is yes. Then we'll switch or add on. I'm just ad-libbing here for a second. If the amitriptyline is not doing the trick, you still having the neuropathy, we will add on a drug that works on GABA in the brain. That is called gabapentin, known as Neurontin, or pregabalin, known as Lyrica. Generally, adding on is better than stopping the first one and adding the second one, or starting a second one. Because when we see amitriptyline with Lyrica, you tend to get better results. So that's for pain, you all, pain management. I don't know much about this Savella. Does anybody? I have not seen a lot of patients on it. Anybody? This last drug here? Yes, yes, no, no for fibromyalgia? Rheumatologist? Yeah. One of the better things for fibromyalgia, interestingly, is vitamin D. You might be seeing a lot of patients put on high-dose vitamin D for fibromyalgia. Okay, moving on. Is there a better SSRI? The answer I've already answered that. Sertraline and escitalopram, Zoloft, and Lexapro. Celexa would be right up there at the top. Prozac for kids, not for the elderly. What's the one rule in geriatric medicine? You never give a drug whose half-life is longer than their life. That would be Prozac. So, we don't, again, you know, it's interesting. I flew to Alaska to teach, into the northern reaches of Alaska, where they do not have a large Walgreens or CVS on every corner that has a pharmacology department, a pharmacy department that's the size of Texas. So generally in these small towns or outposts in Alaska, you get one drug from each class. That's it. So in the world of antidepressant, the only drug they have is Prozac. So if you've got an older person up there in Alaska, which is dark 99% of the time, that's depressed, then that's where I mentioned earlier, we will give them Prozac. Because this guy said, what am I going to do, Barb? What do I do? What do I do? He was an ER doc. I said, what do? You give them Prozac once a week. The half-life is 9 days. So you can give this drug, 20 milligrams once a week, to your 80-year-old patients, and it will be fine. Works. Okay. Paxil. Lots of drug interactions, and it's the one drug that causes tremor. As the dose gets higher, your patients might have a tremor. Most people don't want a tremor. And never use this for your demented patients. It's so anticholinergic, it will actually block the effects of the drugs we use called Aricept and Exelon. Those boost acetylcholine, this blocks it. So now you have somebody spending all this money for Aricept. It's not working because they're on Paxil. Okay. You know, patients with early dementia are depressed. Wouldn't you be? If someone said to you, you've got early Alzheimer's? Yeah. I mean, not all of them are, but most of them know what's coming. And that's a tough diagnosis. Okie dokie. So you know your anticholinergic side effects. We can go through them real quick. Confusion, pupillary dilation, tachycardia, decreased salivation, decreased peristalsis, and tighten the urinary sphincter. They can't pee, they can't poop, they have a dry mouth, they're having an MI, they can't see, and they can't find their way out of Walmart. So, plus they're now having chest pain. They take their nitroglycerin, but their mouth is dry. So what happens with the nitroglycerin? It won't work. They say, oh, damn it, this didn't work, and let me put another pill in. By the time they get to the emergency room, they have 16 nitroglycerin under their tongue, and not one of them's working because their mouth's so dry. So, terrible side effects. Okay, so we talked about sex already. Boosts serotonin, makes you happy, blocks dopamine, no sex. Now, guys, well, Mike, you're the only guy in the room. Sorry about that. But if premature ejaculation is your problem, which you don't have to talk about, the SSRIs are for you. Low serotonin is part of the problem, you all. Love this cartoon. Premature ejaculation clinic. You're early. Oh, my. Silly. Okay, so those of you prescribing these drugs, there's a few other things that people don't know about the SSRIs. Number one, low dopamine contributes to bruxism, grinding your teeth. There are people that are on these drugs wake up every morning and say, oh, my jaw really hurts. Or their wife says to them, or husband says, God, you're making the most noise at night. You are grinding, grinding, grinding. These drugs can cause significant teeth grinding. Low dopamine is also responsible for restless leg syndrome. So restless leg syndrome is very uncomfortable. You feel like your legs are moving. They might not be, but it's constant. It feels like constant movement. The other thing for restless leg syndrome, you all check their iron levels. Iron deficiency anemia is quite common in people who have restless leg syndrome. Platelet problems and hyponatremia. This is important with you geriatric nurses. You can have a patient on Zoloft. Zoloft is the biggest offender. We use it in the geriatric patient because it's a short half-life. But it's the biggest offender for low sodium. ER docs should know this. ER nurses should know this. We got lots of older people coming in with low sodium. They are as confused. They cannot find their way out of a paper bag. They might even be seizing. And you look for all the cases. You look for all the causes. Number one cause of low sodium in the elderly is usually something like Lasix. No, we're not on Lasix. Hydrochlorothiazide. Not on hydrochlorothiazide. What else could it be? Are they on Zoloft? Okay, then. People say, Barb, you've given me that Zoloft. It's not working. How long have you been on it? 3 days. Give them at least 8 weeks to work. They should start feeling better. Some patients feel better in 6 weeks. Some people say, I feel better. It's been 5 weeks, but it's not going to work tomorrow. One of the first things you'll notice in patients as they're getting better is their negativity improves. So they start not feeling so negative about everything. So once that starts popping up, then you know the drug is working. So how long do you stay on them? At least 6 to 12 months after everything has improved. Once they're back to doing everything, another 6 to 12 months. My rule of thumb is at least 9 months, which catches you right smack dab in the middle of that. And then they say, well, can I stay on it longer? Of course you can. You can stay on an antidepressant until the day you die. I don't care. You feel like staying on it? Stay on it. There's no reason to come off of it. Sometimes people are only on them for situational depression. You all, their husband died. It's like, oh my God, it was sudden death. So yeah, we'll put you on it for a year. And then they say, I think I'm ready to come off. That's fine. Other people need it for a longer period of time. Okay, augmentation strategies. Add bupropion, Wellbutrin. You can add other drugs. I honestly prefer, as I'm a nurse practitioner, if I'm going to start adding on drugs, I want a psychiatrist to help me. This is a pretty, we can add Abilify, we can add all sorts of drugs, but I want somebody that knows a lot more about it than I do to do that. Okay? Yeah?
What about Wellbutrin to quit smoking?
Yeah. That and Chantix, varenicline, is also a drug. Actually, that one works better. The Chantix works better. Do they have psychosis? Maybe. But stopping smoking, it makes you crazy anyway. Yeah, there's some psychiatric side effects. But honestly, the long-term effects of stopping smoking is a lot more significant than perhaps psychiatric side effects. Just read a study on the Wellbutrin versus or Zyban, they call it, for smoking cessation, versus the Chantix. Chantix comes out far ahead of the Wellbutrin. Got to be ready to stop, though. It's a tough one. How many people try to stop smoking and fail? Huh?
I'm taking Wellbutrin.
Good. Good.
I tried to smoke, it just tasted really bad.
Good.
So I haven't smoked for about 8 years now.
Are you using a patch or anything else along with it? Just the Wellbutrin? Okay. Well, keep it up. Keep up the good work. Yes, you better believe it. It's tough.